selfishly, you know, one of the things I'm grateful for are the relationships and the friendships that
I know. Wouldn't have known them.
Yeah,
Had he not had ALS. And it's like,
there's been many, and that's the model that we've created at Compassionate Care, that it's a relational model. There's the opportunity for relationships to unfold, like with Kevin, like with Wally, like with John, like
and so
with
it's such
Jim.
beautiful
It just
work.
goes on and on.
And you're not meeting with folks in a hospital setting. And for the most part, you know, you're meeting them where they live. These relationships become friendships, and the intimacy is I think helped and facilitated by the fact that you are coming to them. You're coming to people's living rooms and bedrooms and getting to know them in their space, which is really intimate. And to be invited in like that it's such an honor, and just invites a closeness really quickly, I think.
And that's the model that we've created, that I've been doing since I've been doing this for almost 20 years now. And the importance of it's like the doctors coming into the home. Yeah. It's like the house call program that MGH and CCALS are fortunately now doing together.
Yeah, can you tell us a little bit about that, this house call
program?
Well,
I was fortunate to meet a family from New York that has a foundation, and there's all this commonality in how we met and old relationships that they actually connect back to Gordon, as strange as that sounds. Okay. And I was working with this family, and Merit Chakovitz, head of neurology at MGH. You know Merit well.
Yeah.
One of the top ALS docs in the world. She was Gordon's neurologist.
Yeah.
She was working with the family as well. We knew each other. We knew that, we were both involved. But then I got a call from the daughter, an email, and through her mom, that they have a foundation, and they created a house call program in New York City through their foundation with one of the hospitals for the elderly in New York City.
Okay.
So where nurses and doctors and staff would go visit the elders in their homes.
Okay.
So the daughter, who unfortunately was diagnosed with ALS, and who's incredibly active and has an extraordinary spirit, said, why don't we create a house call program for Boston? We'll do, like a trial. Let's see what it looks like. Would y'all be interested? And so I'm going.
And for ALS community.
For the ALS community.
Yeah.
Strictly the ALS community. Yeah. Let's replicate what we've done in New York for the elders. So Merit said yes. I said yes. And so
it took. You all say yes.
Yeah, it took a while to figure it all out.
Yeah, but you guys
do the paperwork.
Yeah, she's phenomenal as well.
And because Merit and MGH has been sending families to us since I've started, Merit knows my work probably better and appreciates it more, because it took a long time for people to figure out who I was and what I was doing.
Well,
because it's so outside the box.
You're not
I'm not in the system.
In the system, right?
No,
yeah.
No. And quite frankly, if I was in the system, I wouldn't be doing what I do, because I couldn't do that.
Right.
And anyway, in our work, there's no bureaucracy. There's minimal, at best, paperwork. It's like, what needs to happen? How can we be of service? And so Merit and I, over the years, how do we, so it's come together in a really beautiful way. Mm-hmm. So we've been doing it for several months now. The launch was, I guess, in November. And we're finding our way. And my hunch is it's going to be an extraordinary program. It already is. It's fun for me to be able to go into homes with some of the staff from MGH, because they can see what I bring and what we do.
Yeah.
And it's really nice to be able to sit back and truly listen and watch and see what they do. So
it's a perfect collaboration.
And
in so many
Aaron
ways.
is very involved with it, my staff. So it's a wonderful model that hopefully can be replicated elsewhere along the way. No different than...
Yeah, we need you for Alzheimer's. We need you for...
Well, no different than replicating our model for, other neurologicals. And so I'm dreaming into that.
Yes.
Merit and I have talked about that. And that's just funding, quite frankly. And if you have funding, you can have staff, because
Okay.
it takes people to do this work. But why shouldn't our model that we've created be a model for all of healthcare?
I was just going to say, you know, healthcare only exists the way it does because we chose it that way. It's recent. You know, our healthcare system works and doesn't work. We don't have to be stuck with it. Yeah. And so I love people like Merit who are thinking outside their box, and that the healthcare system doesn't have to work where people come to the hospital, and how difficult that is for people with ALS and their families to, well, we need a van, and we need, like, how are we going to do it? And it's so uncomfortable, and it takes all day, and it's just awful. And it's like, you know, what if we could just bring you guys,
Sure. And, you know, we've talked about that, you know,
Talks to
about,
you.
you know, Alzheimer's or Huntington's disease, because I've witnessed Alzheimer's. I've witnessed Huntington's disease.
Yeah.
Multi-systems atrophy.
Yeah.
There's lots of commonality and similarity, and everyone deserves appropriate support, right? So we'll see what the future holds in that realm.